Can women who are heavier weight-wise have a water birth, and what's the weight limits? So in a nutshell, absolutely, yes, they can have a water birth. There is nothing contraindicating them being able to have a water birth from the perspective of their weight. However, a lot of units have solid wall water pools that mean that if a woman were to collapse, the heavier that woman or person is, it will be much more difficult to safely get them out of the pool. And hospitals and organisations have a duty of care to their employees to protect their back in terms of manual handling and in terms of risk assessment, being able to appropriately help or support a woman or person out of the pool. And so lots of hospitals and lots of units will recommend that there is a certain BMI cutoff for women and people having access and being able to use the pool in labour and birth. I've certainly known over the years some women and people choose to give birth at home instead and to have an inflatable birthing pool because they are easier to be able to quickly get someone out of the pool. For example, you could burst it really quickly. You could just flatten the sides. Yes, it might flood the environment around it, but it's easier that if a woman or person were to collapse in labour, birth or that postnatal period, then actually you could get them out far easier and far quicker because it's not solid walled pools like they do within maternity services. And if you do have a much higher weight, it is worth a discussion with your midwife, with your obstetrician during pregnancy, so that you can have these conversations early enough, because sometimes there are things that can be facilitated on an individualised birth plan, individualised preferences. It's having these discussions ahead of time so that you are fully informed and to see if there are any mitigations to help reduce the chance of, if there were a collapse, for example, how we can try and reduce the chance of that happening, how to prevent it happening in the first place, maybe having those conversations ahead of time, maybe doing a risk assessment of someone getting in and out of the pool, for example. There are lots of things that might be able to be facilitated, but having those individual conversations really early on will really help you decide what is best for you and hopefully get you the type of birth that you want.